We are nearly to the end of the Transitioning Youth to Adult Care course. Let's recap some key points. Every individual at every age needs medically and developmentally appropriate care. Transition planning is the purposeful, planned movement of adolescents and young adults with or without chronic physical and medical conditions from a child-centered care model to an adult-oriented healthcare system. The transition planning process involves all stakeholders: youth, physician and staff, and family or guardian. This course provided information and resources to guide physicians as they help patients and caregivers make a smooth transition to the adult healthcare model. It provided quality improvement tools, strategies, and ideas for change to measure and improve the transition planning services you provide to patients in your practice. This course used the widely accepted Model for Improvement, which tests change on a small scale through Plan, Do, Study, Act cycles to accelerate change. This course provided several project-developed quality improvement tools, including 1. The Adolescent Transition Planning Checklist, 2. The Transition Data Collection Tool, 3. The Aims and Measures Grid, 4. The Barriers and Ideas for Change Grid, and 5. The PDSA Planning Worksheet. They are available under the Tools tab for future reference. Here are a few reminders about making quality improvement strides in your practice. In the words of Michelangelo, the greater danger for most of us lies not in setting our aim too high and falling short, but in setting our aim too low and achieving our mark. Therefore, aim high but start small. The PDSA cycle of improvement will help you make small tests of change in rapid succession, learn from experience and be persistent, and maintain momentum and build confidence when changes are positive. Of special note to family physicians, internists, and meds-peds physicians. If you enjoyed this course, consider the parallel course on transition for adult-oriented healthcare providers. That course helps you improve transition services for young adults transitioning into your practice. You should now be able to define transition and describe why it is important, identify key roles in the transition planning process, and recognize how to optimally perform the key clinical activities, or KCAs, identified in this course for transition planning. As you saw throughout each module, this course is resource-rich. You should be familiar with the policies, guidelines, and QI tools to improve transition planning care for patients in your practice. We hope you have become acquainted with the project-developed resources, websites, and more located under the Tools tab. The Printable Resources list is a handy tool for future reference. You can purchase printed copies of handouts, such as the Transition Checklist for Teens and the Transition Checklist for Parents and Caregivers, in sets of 25. Purchasing information is available under the Tools tab. Families can locate handouts and other pertinent materials on the ICAP website. Finally, note the articles referenced in the course. In addition, here are some articles consulted in the development of this training. If you have questions about this training or need technical assistance, we are here to help. Use the contact information provided here.
You may now begin the data collection portion of this course. Review the QI tools you completed for transition. They will guide which activities will be best for you, your practice, and your patients to apply first. This course requires working on 3 key clinical activities with patients aged 14 and older. These include 1. Provide and explain the written transition policy. 2. Assess healthcare skills. 3. Develop or review transition goals. The data collection track will give you instructions and tools for sampling strategies, baseline data collection, automatic reminders to collect data every 6 weeks, and how to generate progress reports within the learning management system. Use these tools and charts to measure your success in improving transitions care. The American Board of Pediatrics approved this course for Maintenance of Certification, Part 4, Performance and Practice Points. To receive this credit, you must collect baseline data and then track your improvement. Complete 3 cycles of improvement activity with chart reviews every 6 weeks for 4.5 months. Whether you complete the data collection track for MOC points, health insurance incentive programs, to win grants related to healthcare reform, or internal QI purposes, the ICAP Learning Management System will guide you to complete all required components. The data collection track of this course is open to all practice staff who wish to collect and document their own quality improvement progress through chart reviews.